Hi everybody, Michelle Lyons with you back again. I wanted to talk to you today about issues with pelvic health for women after breast cancer treatment. Oftentimes when we talk about breast cancer rehab, the focus initially is all about the breast, whether or not there's reconstruction, scar management, shoulder function or dysfunction, the lymphatic system. But moving down the line, because more women are living longer after breast cancer treatment ends, we do need to consider pelvic health. And there has been, an increase in the research looking at pelvic health issues for women after breast cancer treatment. Not as much as I'd like, but it's improving on what it was. If you looked about 5 years ago, all of the research around pelvic health and breast cancer was focused on sexual function or dysfunction. And I think what we're seeing now is a more all-encompassing approach where pelvic health is actually looking at bladder function, bowel function or dysfunction, prolapse issues, as well as pelvic pain for women after breast cancer. In the breast cancer rehab course, we do talk in depth about all of these issues, but I think it really is important to remember that for many women, pelvic health concerns can be a barrier towards exercise. And that's really, really important and something that we need to acknowledge, because if a woman can't exercise, she's really missing out on a strongly evidence-based approach to decrease her risk of cancer recurrence, to improve her bone density, to improve her cardiac health. And this is really important because 20% of women who die after a breast cancer diagnosis actually die from a heart attack. So we know that exercise and stress management are vital when it comes to good heart health for all women, but particularly after breast cancer treatment, where she may have to deal with some of the cardiotoxic effects of chemotherapy, of radiation scatter to the cardiovascular field. So exercise is a really important management strategy for general well-being, for mental health particularly as well after breast cancer treatment. We already know for up to 50% of women over the age of 50 that pelvic health concerns, particularly bladder leakage, can be a barrier towards participating in exercise. So the first thing we have to do is acknowledge that there may be a problem, and then of course come up with strategies to help women deal with that. We want to make sure we're looking at global exercise prescription strategies and benefits here as well, because we know that diaphragm and pelvic floor coupling, really, really important for good pelvic floor muscle coordination and continence management and prolapse management. We need good pelvic floor muscle coordination for all of these things, particularly, bowel health, constipation. But we can't do that without good breathing capabilities. So thoracic movement, really, really important to regain good shoulder, thoracic, latissimus dorsi movement and function during and after breast cancer. If we have a look at some of the issues that we cover in the breast cancer course, we talk about a lot of different issues in this particular module, but particularly we look at each of the different aspects of pelvic health. We talk about genitourinary syndrome of menopause in breast cancer survivors. And what we know is that definitely there are direct effects from several of the breast cancer treatment options that are available to women, but they all have side effects. So chemotherapy, ovarian suppression, ovarian removal if a woman has hormonally driven cancer, and then the hormonal or endocrine therapies themselves. So whether that's aromatase inhibitors or tamoxifen, we know from the research that tamoxifen is positively correlated with urinary incontinence, but not a lot of women know that or are expecting that. So a lot of the tissues in the perineum, in the pelvis, the opening, around the urethra, the vagina, and the anus, these are areas that are really rich in estrogen receptors. So if you're embarking on a strategy to decrease the amount of available estrogen in your body, because that's a driver for your breast cancer, there are going to be many pelvic health issues that you're going to have to deal with. Luckily, what I've tried to do in this course is give you a toolbox for managing these. So we talk about the very real issues around, let's talk about constipation, for example. we talk about how constipation in and of itself, when it happens, it can be really hard to get moving, literally, with that. It is linked to back pain in women generally. But if you are a breast cancer survivor dealing with constipation, then you also have this added stress on your lymphatic system, which may have been compromised by either surgery or radiation. You're going to have decreased capabilities of really enjoying movement, first of all, but also the effects of constipation on bladder irritation as well. So we already know that in genital urinary syndrome of menopause in breast cancer survivors, we already are seeing issues with dysuria, which is painful urination, urinary incontinence, increased urgency and frequency, and we know that constipation can be a driver for that as well. We want to be also looking at the other end of the spectrum from constipation, which would be anal incontinence. And because we're losing some of that bioavailable estrogen in the body, because, you know, if you've got a hormonally driven cancer, we want to decrease the levels of circulating estrogen, then that can also affect anal incontinence. So we talk about, you know, the right things to eat, about building a better stool, about really promoting good toileting strategies, but good pelvic health. Now, it's not just chemotherapy and hormonal therapy that can affect pelvic health, but, you know, some of the other medications that women may be on. So, for example, SSRIs are going to have an effect on both weight gain and on sexual function. So we talk about that. But also, if you're on steroids, if you're on antibiotics, those can leave you more prone to developing issues like thrush, candida infections. So we talk about the importance of good vulvar hygiene, and really trying to give women a toolbox for good self-care during and after cancer treatment. I think one of the most important things that often gets overlooked is the effect of scarring, particularly abdominal scarring if there's been breast reconstruction, say a DIEP or a TRAM, and the effect that that can have on pelvic health as well. So I've tried to provide you with, again, a range of strategies for good scar mobility, as well as all the self-care, nutrition, exercise, movement, and lifestyle toolbox, hopefully to get you through all those pelvic health concerns that women may have during and after breast cancer. It's really important to me that as women's health providers, we create a language around talking about these issues, which may not be top priority for women who are going through breast cancer treatment, but they can be significant restrictors of quality of life after breast cancer ends, certainly. And if we're looking at a scenario where women are, you know, going to be on tamoxifen for 10 years after active breast cancer treatment, that's a long time to be limited in your ability to engage in exercise or to fully enjoy your life after cancer treatment ends. So really, it's important as women's healthcare providers that we ask the questions, we know what questions to ask, and then we know what to do with the answers as well, that we can provide strategies to help women optimize bladder, bowel, sexual health. Prolapse is the other area that we need to talk a little bit about as well, because it's a very common issue that many women in their 40s and their 50s are dealing with, particularly in a situation where estrogen will be declining anyway. But if we're looking at a situation where we already have the effects of low estrogen on connective tissue and the strength of the fascial integrity and the ligaments that are keeping the pelvic organs up where they're supposed to be, and now we add in some constipation, we might be also looking at a scenario where, due to chemotherapy, we're losing muscle mass in the arms and in the legs, and so we're more likely to strain as we're lifting things or going from sitting to standing. And all of these issues can put a large strain on maintaining your pelvic organs where they're supposed to be, and can be a pathway towards pelvic organ prolapse. So it's always easier to prevent a problem than it is to fix it. But it's important to remember as well, there are lots of conservative measures that we can do if there is a mild prolapse developing, in terms of managing that intra-abdominal pressure, making sure that we're focusing on good upper body and good glute strength, good pelvic floor muscle coordination and strength, and teaching women how to manage intra-abdominal pressure in their everyday activities. So that's a brief overview of what we talk about in the pelvic health module of the breast cancer rehab course. If you have any questions about the questions that I've raised today, do let me know. And if you'd like to join us in the breast cancer rehab course, if you visit celebratemuliebrity.com and head over to the online courses, you'll find all the information there. We do have a closed Facebook support group for attendees of the course as well, where I'm continuously posting research and hopefully some useful strategies as ongoing support after the course ends for you. Thanks very much for watching, and I will talk to you next time. Bye for now.